So the topic we want to discuss is about flossing. I think everyone knows how important flossing is, but I think not many people are actually doing it every day. We have some flossing product launching in November. So we wanted to kind of have this time to discuss more about flossing, what's so important, why we're doing it, do it before or after, and does it even matter?
So pretty much, I think about a year or two ago, something came out in the news saying that flossing is, irrelevant. It doesn't do much, and it's basically a waste of time. And there's no clinical studies stating that flossing is effective. Then some other things came out about how a majority of floss has plastic components in it, and then we could be finding plastic, particles or byproducts in our blood from all this stuff. So I think in private practice, maybe 1 out of 10 times, not too often, someone will reference one of those two topics and state that, is flossing really that important? My answer always is we don't really need hardcore evidence to show this is important, because from clinical anecdotal evidence just that we see every day, we see a difference in people who floss and don't floss. The whole purpose of flossing is to remove plaque between teeth, to prevent cavities, and to remove plaque from underneath the gum line, to prevent gum disease and the progression of gum disease. So
just to piggyback off that, I agree 100%. Additionally, if we only brush what we can see, we're maybe missing about 2/3 of what's happening in our mouth, because not only are the teeth important, but where the teeth touch each other is important, and what the teeth are being housed in, which is the bone and the gum, is critical. So if we don't take care of that, it really doesn't matter, for lack of a better term, like how nice and white our teeth are. In private practice, we see healthy teeth all the time that are in unhealthy bone, and sadly those teeth get lost just as often.
Yeah, there's a lot of spots that, as a patient, that you're not going to be aren't very obvious for you to tell that plaque can be accumulating in. And not all our teeth are going to be virgin teeth that have not had work done on them. So they might have fillings on them, they might have crown work or something else done on them that can just cause these areas for that bacteria to accumulate. And so we have to be doing these adjunctive things in addition to brushing to be able to reach those areas to kind of clear that away.
And a lot of patients comment that, when they start flossing, that they notice a lot of bleeding. That's actually a sign of inflammation that's already present. So I always tell patients, you have to start flossing every day, and then you'll actually see a reduce in bleeding and inflammation. So it's actually going to help you. I always remind patients that, buying floss is actually the best investment, that you can make.
Do you floss before or after brushing teeth? Before brushing teeth, raise your hand.
Before.
Okay, so 4 out of 5. That's actually really interesting, because I think most people actually floss afterwards.
It's more out of habit. And when patients usually ask me, should I floss before or after, I always say floss when you're actually going to do it. My most important thing I want you to do is to floss. So whenever it works in your regimen, just do it. For me, I like to floss after brushing, because I like to know that I got the majority of whatever is lying on my teeth out, and that flossing is just basically focusing on the interproximals and around the gum line. I don't want to see chunks of things coming out, so I just a matter of what I want to see. But after doing some research, especially with certain types of toothpaste, I see the importance of flossing before, because you want to have more contact time with certain ingredients in toothpaste. So I think it depends on what your regimen is and what your risk is in terms of perio and cavities. If you're going to do it in the morning, you're going to do it at night, I just want you to do it.
Exactly. Yeah. If you're going to do it at whatever point in the day, just go for it. I know obviously that you can get technical and kind of the benefits of doing it before or after, but yeah, just getting it done at all is going to be beneficial, period.
I used to floss afterwards. So I like to kind of get my whole mouth clean first. So you have that feeling of like accomplishing something big. And then later on, the flossing part is more like de-stressing, you're doing the rest of the work. But I remember reading this article that mentioned that if you actually floss before, you'll be able to have, the ingredients that remineralize your teeth reach those spaces. And also they saw a greater reduction in plaque. So after I read that article, I was like, oh, actually, maybe I'm wrong. Maybe I should stick to the other routine.
I think for me, the biggest thing was just contact time of the active ingredients. So even rinsing after I brush, I try not to do as much anymore. So I'll floss, then I'll brush, spit, of course, but the longer you can have it sit, I think the better it is for, remineralizing enamel and, healthy gums and everything else.
Do you actually floss every single day, or sometimes you feel lazy and skip?
Once in a while.
We're not perfect.
We're all guilty.
You know what it's like if you regularly go to the gym, which I'm sure a lot of us are not anymore, but if you regularly go, you feel better, even if you're going once a week, twice a week, doing that, and your muscles are built up better to withstand you maybe not going for like 2 weeks straight. So it's like if you're a regular flosser and you fall off the wagon because you go on vacation, when you pick back up, you don't notice much damage done to your teeth and your gums. So it's all about, I think, the sustainability of you doing it versus like how often you do it. Like, are you a regular flosser sort of thing? Does that kind of make sense?
Yeah.
Yeah, it makes sense. Yeah, definitely.
That's actually a really good analogy.
And also, like, I feel like as dentists, we know too much of what's going on. So if we don't floss, we know the consequences. I think it's really hard for us to skip that step.
What's your recommendation for super tight contact and if the floss is thread through it?
For people with really, really tight teeth, I actually recommend the thinner sort of, I won't mention any brands, but the thinner Teflon tape style floss. You do get plaque around that contact point though. So you definitely need to put something through to prevent that plaque buildup. It's tough though. They just need thinner floss.
Yeah, that's something I struggle with. I shred most flosses. I think technique is everything. I took for granted that we all know how to floss. And I think, once you actually have really a good hygienist or oral health instructions and you show people how to do it correctly, that makes a world of difference. But technique is something that I think could get around it.
Yeah, you like being able to show a patient, whether it's on models or if you can do it intraorally and actually show them what's going on in the mouth, like you'd be amazed of kind of like what you can achieve and what their ability of like, whether it's flossing or taking care of like something else in their mouth, like what they can actually, be able to learn and transition into. I think it's critical. Yeah.
Would you, if you have a choice, would you choose a vegan plastic floss or compostable silk floss? I did this quick poll on the Instagram story. About 1 out of 10 people do prefer vegan plastic floss.
In general, I've been trying to just reduce plastic. Any opportunity we have, we do get patients now that ask a lot more about what materials night guards are made of, what goes into the toothpaste, what goes into their filling materials. And it feels good to be able to let them know that we're doing our small part, in environmental care. I do think I would prefer something compostable.
Mm-hmm.
Yeah, I think like Dr. Cummins said, the more environmentally friendly and the more sustainable the floss is or any product that we use, I think patients will be really interested in those items. And a lot of people are anti-plastic for the environment, but also it's an endocrine disruptor. So for health reasons as well, we want to make sure what we're, even though we're not ingesting it, we're using it every day. Like I'm sure parts of that are getting into our system, whether these parts are, it's a large enough dose, I don't know, but I would rather something that's more natural. So I'd probably use silk as well.
Everyone's becoming more aware of what, our products are made of. So if you give the options, I think that's the most important thing, giving all the options, and they can really choose, what can benefit us, just not for our health, but also for the environment.
I mean, yeah, just being conscious in general, just and trying to do your best to, again, keep those things in mind. I think that that's what you want to be doing.
Mhm. What do you think of floss that's kind of infused with treatment ingredients? Do you think kind of getting that ingredient through the in between teeth and around the gum can be helpful?
Going back to the whole concept of intention and routine, flossing is pretty passive for most people. You just kind of zone out and go through it. But if you can make it an active part of your routine, the idea of placing an active ingredient somewhere where the brush can't get to, or where mouthwash might not get to, I think anyone health conscious would be a fan of it.
Thank you so much for the great discussion today.